Hello, and welcome to Rebloom, where we talk about facts and empower women. I am your host, Tegan. Today we're diving into a condition that affects 1 in 10 women in the UK, and it's often a misunderstood condition. This is polycystic ovarian syndrome, or otherwise known as PCOS. If you or someone you know has been diagnosed, or you're just curious to learn more, then stay tuned. We're going to be discussing what it really is, how it affects the body and the mind, but also what can be done to cope and live with the condition. So in 2024, I was diagnosed with PCOS, and it was a term that I had never heard of. I didn't even know it existed. I spent some time researching, and it just felt like I was given more ads to a product than actual helpful tips. Why is there so many supplements out there that are meant to be so good for PCOS or any other health conditions, or so many weight loss drugs out at the moment? And a lot of times companies brand them towards PCOS. At least I found that when I've been looking online and just trying to do research. And it's just so frustrating to try and figure out the world of PCOS. But I also found that when I did try and find advice, and I did find a piece on the internet, it was like there was another person the next minute saying the complete opposite and saying not to do that advice and to go with something else. So going into the definition of PCOS, so this is a hormonal disorder which primarily affects the ovaries. However, we do note that it causes so many issues within the whole body as well. So to be diagnosed with PCOS, you have to have 2 of the following criteria. So we have hyperandrogenism. This is known as male hormones. So you might know the most common one, which is testosterone. So testosterone can show, and hyperandrogenism can show as alopecia, so hair thinning or hair loss. Hirsutism, so this is betterwise known as male patterned hair growth. So hair on your face, hair on your chin, your neck, and down to your chest. Polycystic ovaries, so this would mean that on ultrasound, you had been found to have 10 or more cysts on your ovaries. This is what is used in the UK. And we would also have irregular ovulation. So this would show as irregular periods. So this criteria that I just explained is based on the Rotterdam criteria, and this is what is used in England, where I'm from. PCOS impacts so many areas of health, though. It's not just the ovaries. So you have weight gain, you do have regular periods, as I just mentioned, the hair growth, and it has such a huge impact on mental health and self-worth and self-confidence. Unfortunately, it is not yet known why PCOS is caused. However, there is some contributing factors, such as your genetics, what you inherit from your parents and your family, but also your environment. However, nothing as of yet has been directly pinpointed to cause PCOS. A key thing I want to mention with PCOS is insulin resistance. So insulin resistance is a key factor which can affect your PCOS. Insulin is a hormone that helps to control your blood sugar levels. With insulin resistance, what happens is the cells in your body stop responding to this insulin, and it no longer stores the sugar that's in your blood. So it's just left there. This can cause a range of complications. But insulin resistance can impact a lot of areas for women with PCOS. So, for example, impacting key hormones for ovulation, as we talked earlier, that's part of the criteria. So, the main hormone which affects ovulation is known as the luteinizing hormone, or LH, and this is released by the pituitary gland. But there is also estrogen that is impacted by insulin resistance, and this has so many roles in the body, including development of secondary sex characteristics, so this can impact teenagers more, but also your metabolism. By affecting your metabolism, this can further reduce insulin sensitivity. So this is causing a never-ending cycle. So, you have the imbalance of estrogen, which causes insulin resistance to increase, which causes a further imbalance of the estrogen, and this keeps on going. So I just want to point out, PCOS is not caused by eating too much sugar, and someone who has the condition shouldn't be blamed for causing its development or being judged because of their lifestyle. PCOS is just so complex, and it's a medical condition which deserves so much care and attention. And if anyone does suffer with PCOS, you shouldn't blame yourself for the symptoms coming along, because that's not fair on you, and sometimes things like this just happen in the body. If you are worried that you have PCOS, there are some symptoms that you should look out for. So, for example, irregular periods or not having any periods for 3 months or longer. So, the periods not being about for 3 months or longer, this is a medical term known as secondary amenorrhea. Excess body or facial hair, this again is linked to the testosterone that we was on about earlier. Acne or oily skin, again this is caused by increased levels of testosterone. And difficulty losing weight, so this is down to the insulin sensitivity. And difficulty losing weight, this is again due to this insulin resistance that is caused by PCOS. For someone who is wanting to go to the doctor and they think that they may have a condition, one of my top tips would be going to your GP appointment prepared. You have such little time once you get to the appointment, and sometimes when you've been waiting so long, you just get so overwhelmed in the moment and you forget everything. So I would say write down your symptoms, track your periods, and be able to tell your doctor what has changed and how long this change has been going on for. So for this, I would really recommend going to the Menstrual Health Project's website. They have an amazing toolkit online, and it has in the back of their toolkit an area that you can write out all your information, all your details, all your symptoms, and you can go in prepared. So some things for me that I have really struggled with are extremely painful periods. So some things that I have found is managing my time where possible. So I know that with PCOS that my periods are all over the place. However, I personally get cramps for a few days beforehand, before I start my period, and I know that it's going to be really painful. So what I try and do is I try and shift my schedule, and I try and keep the first 1 or 2 days clear of my period, because I know I'm not going to get much work done because I'm going to be in a lot of pain. However, if I do need to go out whilst I'm on my period, I have my PCOS survival kit with me. So in here I put in ibuprofen or paracetamol. Even though sometimes they don't help, I do like to have them when the pain is starting, so I can try and get ahead of it. I have heat patches that stick to my clothes, so I can put them on if I'm having cramps, and they just help me to reduce that pain again. I always try and have snacks as well, so like breakfast bars or biscuits, just anything really to get my energy up, because I get so tired when I start my periods. And I frequently have heavy periods, so I always wear period underwear along with my sanitary products. However, I always try and keep my some spare underwear, and also have plenty of pads, tampons, and stuff like that, because I am so nervous about leaking. PCOS can cause an increased risk for other health conditions as well. So when I was on about complications earlier, this includes stuff like type 2 diabetes, heart disease, but also mental health challenges such as anxiety or depression. So one of the big things with PCOS is, like I said, the self-confidence. Bodies are changing, and sometimes as well, if people are trying to lose weight, it can be so hard, and the impacts on your mental health on that can be huge. So I would say if you are struggling with any of these at all, not just the mental health, the physical health, go to your doctor, see what they can do, see what support they can give you. And for mental health stuff as well, you have like the Mind Charity and Verity and PCOS. They have a lot of resources as well available. There are some things which can be done to improve PCOS. So for example, the one thing that they say every time at the doctor's appointments is diet, exercise, and stress management. This looks different to each person, and I think that's really important to remember. Sometimes if you can try and get a nutritionist to talk to you, try and make an achievable and beneficial diet plan. Sometimes what works for one person isn't going to work for the next person. And don't beat yourself up if a certain diet or a certain lifestyle isn't working for you. But also don't feel forced to go on a diet or to feel like you need to make all these big life changes if you aren't ready yet just because you have PCOS. I didn't start trying to look after myself a lot more and change my lifestyle until this year. And I think that it's really hard to try and motivate yourself, especially for me because I'm not a very sporty person. So I think just be kind to yourself. And if you are wanting to do these, try and do little changes. Little changes and consistent changes are going to make a bigger impact than doing one big change for a week or two. If you are struggling to exercise like me, it's important to note again, small consistent movement is better than nothing. Going on a treadmill for an extra 10 minutes a day is better than the 10 minutes that you wouldn't have spent on the treadmill. Even if you're just walking, you don't have to run. And I think that's something that I've found really tough to learn because I'm really hard on myself. So I think if you are in the same position, try not to be hard on yourself. And small changes are better than big changes if you can keep sticking to that change. And again, don't be too hard on yourself if you're having cheat days or setbacks or whatever you want to call them. It's okay to have a day where you don't stick to one goal. It's okay. I think, like, for me, I had my birthday recently and I was really trying to cut out sugar. That's just a personal choice that I had made. But then I had so much cake. And, it was really difficult. But I didn't want to take that away from myself because it's my birthday. And, I didn't make myself feel bad for that. It's okay. If your story was similar to mine, then you would have been offered contraception to help with your PCOS. And I know this isn't ideal, and I know that it is so frustrating because the contraception does just mask the symptoms and it doesn't help with getting to the root cause. And I know how deflating it can feel to just be offered contraception and that's it, because I've been there too. However, when I've been researching about this, there have been some studies, for example, by Fraser et al., 2020, if anyone's interested, that this study has shown that contraceptive pill is better at lowering testosterone levels and helps improve menstrual patterns, so periods every month, when compared to metformin. So if you have PCOS, you might know about this drug, but if not, metformin is an off-label medication which is given to help relieve symptoms of PCOS. Metformin is a drug given to diabetics, so it helps with that insulin resistance. Helping with that insulin resistance, you're helping with the estrogen hormones, and it helps that way. If I know anything, it is that living with PCOS can be so overwhelming. But knowledge is power, and I hope that I've helped you to understand a little bit more about PCOS than you did before this episode. Advocating for your health is so important. Don't be afraid to prioritize your own health and well-being. This has been such a hard realization for me and such a hard thing for me to learn, but I hope over time that anyone struggling with any medical condition can learn to prioritize yourself, because it is so hard, and life keeps going on and you feel like you're just trying to catch up, but you can do this and I believe in you. So yeah, if anyone who's listening suffers with PCOS, I hope that you can find and create the support net that you deserve. And if you are struggling, there are so many online groups where people support each other. People give out advice, people give tips that work for them. Obviously, you don't have to take all the advice, but sometimes it's really nice and it shows that you're not alone with this condition, which is how I felt when I first got diagnosed. Thank you for listening to Rebloom. If you found this episode helpful, please share it with someone who might benefit. And remember, you are not alone in this journey. Until next time, take care of yourselves. Goodbye.